So this is a definition of sepsis based in this surviving sepsis campaign, no, and the management of sepsis. Oh my God, yes. The management of sepsis based in the few since many years by the recommendations of sepsis, surviving sepsis campaign. But it's important to distinguish that the surviving sepsis campaign in the last recommendation had more than 95 recommendations with a low grade of evidence in only 5-6 recommendations associated direct of infection and microbiological tests or antibiotic use. So the most of recommendations with a low grade of evidence is associated of supportive treatments, etc. So this is a bundle of the first hour, in the based in blood cultures, take lactate, and as you see in these recommendations in antibiotic use, not time, and use of PKPD to improve this use of antibiotics. So it's very important to understand sepsis. Sepsis, we not have a good concepts about this. Why? Because sepsis is a very complex biological system, similar to understand many physics concepts in the universe. In the sepsis, the close relationship between the pathogen, bacterial, virus, fungus, versus against the person, the patient. So this is a very complicated to simplify very much. It may be in the last years we simplify very much to understand sepsis, or the previous colleague talk about the definition of sepsis. So this is a new concept of management of infection, of the understanding infection. This is a technological convergence that use atoms, nanotechnology, sorry so much, informatic database, and neuronal, the cognitive networks, and finally the biological systems, the cells. The combination of all, or combination of 2 or 3, is advance in the medicine and advance in the management of sepsis in the last years. So the genomics is a very important approach that is possible using genomics in different approach or different parts of the sepsis in diagnosis or the use of new treatments. For example, this is a very interesting but complicated study that combine the infection, compare COVID-19 infection with health persons and persons with infection by bacterial or influenza infections. And that use transcriptomica, different omics, genomica, phenotypes to understand the different aspects in the biological models. So as you can see in this study, using a metagenomic with a microbiological test, this metagenomic test had increase the diagnosis of bacterial infection compared of the traditional cultures in blood cultures or respiratory samples. So the use of intrinsic, extrinsic factors, for example, genotypic factors or ambiental factors associated with data source of the infections, and the use of the 4 approaches, genomics, transcriptomics, proteinomics, and metabolomics, using the bioinformatics and big data, machine learning, and artificial intelligence, is proof to understand and then make a diagnosis and then personalized medicine, in this case, personalize the management of sepsis. So this is a very complicated sometimes, but these bioinformatics help us to understand better. So you can develop genotypes in different aspects in diagnosis, for example, in prognosis and treatment. This is a most important or most famous example, the study by Seymour, that this group using artificial intelligence, identify 4 different phenotypes. And they're very important because these different phenotypes have different prognosis of length of stay in ICU or mortality. For example, the alpha phenotypes had only 3% of mortality in ICU, compared of the delta phenotype had a 32% of mortality. This is a study in Spain that in the COVID-19, the first and second wave, that we stayed more than 2,000 patients with COVID-19 admitted in ICUs in multi-center study. And we combined demographic inflammation and organ dysfunction, identified 3 different phenotypes in patients in ICU. The phenotype 3 had more mortality and more severity. So it's very important, before my colleague talk about the sensibility, specificity to diagnosis of sepsis. I think it's an example, the Seymour study and the most important study, meta-analysis by the group of Netherlands. Both studies identify more than 30 variables associated with sepsis, variables such as albumina, eosinopenia, and, for example, demographic variables associated with sepsis. So it's not so easy to identify sepsis with only using the 6 variables by SOFA. This is more complex to understand. And that the use of machine learning, artificial intelligence, as you can see, is not only detect sepsis in the moment that it starts sepsis, but it's possible to predict sepsis until 48 hours before you start the episodes of sepsis. And this is very important because have an area under curve very, very good. In this first study, using different algorithms, it's possible to identify with our under curve more than 0.94, identify patients that you will start sepsis in 40 hours. And the other hand is important too, in this study, very interesting prospective study that compare different scores, different rows scores, and using machine learning, and machine learning using the concept of sepsis 2 and sepsis 3. As you can see, the best model to identify the both best sensibility is a machine learning using a sepsis 2 concept, in compare of sepsis 3, but of course the specificity is higher in the group of. So this is a consequence, yes, because as you can see, this most important study, multi-center study, prospective study using a machine learning before and after in the United States, this have a very interesting consequence, that this decrease the mortality, decrease the length of stay, decrease the readmissions using in multi-center studies this concept. So I have a few minutes. You have 3 minutes? Yes? Okay, so in a few minutes, I talk about our experience using machine learning in the prediction and sepsis in our hospital. This is a national program, and it's divided in 3 parts: in the retrospective, that's finished, in 2 predictive, in real-time prospective, in all areas of hospital, in all patient areas. So in the retrospective, you develop different algorithms using scores rules such as SOFA, quick SOFA, MILS, NILS, etc., and models using only machine learning algorithms. So we receive demographic, vital signs, laboratory data, pharma data, microbiological data, and very important, you use the free test from the triage and the physicians and nurses right in the clinical history. This is this name is natural process language. So it's no unstructured data. The other sources are using structured data. So we identify between 2014, 2018, more than 2 100,000 patients that more than 9,000 had sepsis, and we identify sepsis is a prospective identification, but it's assess is retrospective. So as you can see, using the different analysis, descriptive analysis, pre-processing data, prediction, and finally identify the best models for sepsis prediction and detection. So this is in green, this using raw scores is a sepsis 2 and sepsis 2 plus quick SOFA is a not bad area and curve of sensitivity and specificity, but on the other hand, in blue, as you can see in this slide, the significant increase the detection of sepsis using the machine learning models is not different between the three models. One, finally, the BCEPRO, that we call it, combined machine learning plus sepsis 2. So in the predictive study, we divided this study in pilot phases in our only hospital. In this moment, we expanded in another 4 public hospitals in Spain. And this is interesting because you receive the information of patients with detect the possible of sepsis in real time. As you can see, using the different sources, using the machine learning model that used before, is had a warning for physicians of our multidisciplinary sepsis unit that 20 hours by 7 days. And the important is not only detect patients with sepsis, but predict patients until 48 hours before the start. As you can see and finish, this is compared by rule using traditional sepsis 2, and comparing red is the model with a machine learning. As you can see, they have better specificity, sensitivity, and very, very important precision. So the new wave of artificial intelligence has tried to create machines that will function more than colleagues that are tools. I think it's possible. It's necessary many times, mainly learning about this, but it's possible. Thank you.